Welcome to our December mindfulness moment experience. So, our focus this month is seasonal affective disorder. So, we really want to focus on understanding seasonal affective disorder. So, before we settle into the kind of more mindful meditation part of our experience today, I thought it would be helpful to provide just some information about this type of depression. You may know a lot about it already. Perhaps you suffer from it, but for those who don't, or those who want a little reminder, I'm going to spend just a little bit of time talking about that and defining it for us. Some of the information that I've gathered in my research comes from the Mayo Clinic, if you want to, look further into this. So, seasonal affective disorder is a type of depression that's related to changes in the seasons. Generally, it occurs during the fall into winter transition as the days grow shorter and the evenings grow longer. That seems to trigger this type of depression for people. Although some people actually do suffer from it when we transition out of winter and into spring, but that is less common. And often then, as symptoms will relieve as you move into the longer days and the shorter nights. So this depression, as with other depressions, can really zap you of your energy, make you feel moody, make you feel listless, make you want to sleep a lot. You may find that you crave carbohydrates, which can frequently lead to weight gain, which causes other concerns and issues. Some of us lose some of our social connection during this time of year, maybe due to weather, maybe just due to lack of motivation. But that can be something that you might want to, somebody suffering from this might want to think about. You can also feel helpless or worthless, perhaps even guilty about something. There are even cases where people experience suicide ideation in more severe cases. And some factors that doctors and researchers believe contribute to this type of depression would be first your biological clock, your circadian rhythms. So less sunlight seems to disrupt the body's internal clock. And as a result, people can be drawn into a depression. Serotonin levels, this is a brain chemical, it's a neurotransmitter, and it also can affect your mood. So a drop in serotonin may also play a role in seasonal affective disorder. Melatonin levels, this plays a role in sleep. You hear people taking melatonin to help them regulate their sleep. So when this level in our body changes, it can also lead to or may lead to these kinds of depressions, seasonal affective disorder being one of them. It can disrupt your sleep patterns and that can throw you off. And interestingly, depression can physically change the way your brain works. And I find that so fascinating. But on the flip side of that, mindfulness can also affect the way your brain works, but in a positive way. That's why it's important for us to be talking about this together in this experience. So, who tends to be at risk for this type of depression? Women more than men. Younger adults tend to suffer from it more than older adults. People who have a family history of seasonal affective disorder or other types of depression, or even bipolar disorder. People who really lack vitamin D, maybe especially for people who say work at night and they never get out into the daylight. Those kinds of things. You need some exposure to sunlight. So what are some treatments that can help with this? And again, I'm not a doctor, so if you're suffering from any of from a depression of this nature or any type, you should really see a doctor. But in my research, these are some of the thoughts that I've found. So increasing time outdoors can be very helpful. Just getting exercise can be helpful. So whether that's indoors or outdoors. But if you're outdoors, you not only are getting the benefit of exercising, but you're also getting the sunlight, which is the vitamin D piece that can lead to a reduction in these types of feelings. Under guidance from a doctor, light therapy is something that people find to be positively impactful with seasonal affective disorder. Psychotherapy, medication, and even vitamin D supplements. If your body is low in vitamin D, and you can find that out through blood work, maybe a vitamin D supplement would help. Mindfulness, meditation is also effective. Yoga, mindful meditation, these practices that you can do on your own, in your own home, or you can find places to practice some of these things. But I think it's worth repeating that while depression can physically change how the brain works, so can mindfulness meditation. So let's take the rest of our time together and just do a mindfulness practice, a meditative practice. One that you can practice again on your own without my guidance. So again, always sitting comfortably in a chair or maybe on a couch, maybe lying down. If you fall asleep easily, maybe you don't want to be lying down, but if that's the way you want to practice today, then please do so. I invite you to close your eyes if you're comfortable with that, or you can just gaze off the tip of your nose, finding something on the floor to softly focus on. Focus now on your breath. Just notice it. Inhaling and exhale. Notice if your breath is shallow. Maybe with a focus on it, you're breathing a little bit more deeply. Just notice it without any judgment, just observing it. And imagine now you are laying on a quilt in an open field or meadow. Birds are chirping, flying in and out of woods that surround the meadow. Some flowers have bloomed in that meadow. It's just a lovely, quiet place to rest. And as you lay down on your quilt, you look up to the sky. The azure blue of the sky is really quite stunning. And there's some white clouds, puffy clouds, drifting, passing by in your mind's eye. And now take a moment and notice any thoughts that are arising. See if you can categorize those thoughts or name those thoughts. So for instance, maybe you have work thoughts or future thoughts or thoughts about the to-do list that didn't get done. So that would be past thoughts. Maybe some family thoughts. Just notice what kinds of thoughts keep coming up. Or maybe there's only one kind or one particular thought that keeps coming up. See if you can capture a thought. And then imagine that you place that thought on a cloud and you let it drift off. It doesn't mean it's gone forever. It's just for now, it's not on your mind. Notice how it feels to unburden yourself of that thought. Notice if another thought comes up. Maybe it's the same thought returning, or maybe it's a different thought. Don't judge yourself for it. This is what our brains are designed to do. Just place it on a cloud and let the gentle breeze take that thought. And just notice. Even thoughts such as, this is stupid, I'm not liking this isn't working, this is hard. Any of those types of thoughts which can impede your success when you're trying something new or feeling frustrated by it, just set those on a cloud as well and let them drift off. Return to your breath as something to focus on to help you stay in your body. You get carried away by a particular thought. Just notice that that's happening. Pat yourself on the back for having such awareness that you notice that about yourself. And then place not only the thought, but maybe any feelings that were around that, maybe frustration or annoyance or sadness. Place those as well on the cloud and let them pass you by. Notice for a minute how your body feels. Notice your breath. And as you move through this practice today or on any other day, be sure to give yourself grace, be thoughtful, be forgiving, try and find some calm.